Some people like David. I said David, somebody wants me to say no, David.
Hi, welcome back to Municipal Matters here on TV Cogeco. I'm your host, Dave Glover, and joining me now is John Hassan, the Executive Director of the Port Hope Community Health Center. John, nice to see you.
Yes, nice to see you, and welcome.
Now, we haven't had John to discuss this in quite a while. I guess it's been about a year.
Yep. Yes, I was on with Aldo.
So you were up with Aldo D'Agostino. Now, you have been up and running for a year.
Yes.
How's it going?
Excellent. Very good. We're in a temporary location in the Pineview Plaza. Since June, we've been actually seeing clients and patients coming in for care. And in the fall, we're able to recruit and attract an additional nurse practitioner. And then later in the year, we now have 2 family doctors.
Oh, I saw the advertisement, or the bulletin, if you will, at the former county office saying that they were accepting patients. So,
yes.
So how's that going?
Excellent. Yes, we're almost at 1,000 now.
Is that right?
Yes. Yeah, I was wondering, could we have a little prize for the 1,000th client that we sign up? But
they might not be feeling good.
No, that's right. Yes. Yeah. So we're moving there. We're over 900 now that we've enrolled.
That's incredible.
So it's excellent. Yes.
And now you're constructing, of course, the other site. You're doing the renovation and the work on that. How's that coming along?
It's proceeding on time, and there were a few little glitches, as there always are in construction. But the latest information we've got is that the construction will be finished the first week in April. And then we're starting to have our plans ready to see how we make the transition from our temporary location into the new building. So I'm quite confident by the end of April we'll be up and running in the new building.
In the new building by April? Or the end of April?
End of April, yeah.
That's wonderful.
Yes.
So it's progressing according to plan, obviously?
Yes.
And now, when you were first talking about it, and as we talked before the show during the break, we were talking about the catch basin of 25 kilometers. It's now 50 kilometers.
That's right.
What's the reasoning behind that? Why? You started off slower, I guess.
Yes. It's my understanding when the initial planning was going on for the community health center, there was some discussion that we would have a catchment area of 50 kilometers. And I think the advice was, we'll start a little smaller, reduce it to 25, till you get a sense of what the needs are and where the demands were, but you could increase it to 50. And over the last several months, we've noticed that when we knew that our 2 family docs were coming on board, plus we had 2 nurse practitioners, we could handle more clients. So we went back and said, well, we can go back up to the original target of 50 kilometers. That's a catchment area that we can work within, but anybody can come to us for care, but that's what we want to really target, that area. And within that, we have target groups that we're trying to look at and provide care for.
And do you provide service? Is there sort of an off-site service that is provided to people within that catch basin area?
No, we're just located at this time. I think, Dave, in the coming months or a few years, we may find there are other areas that maybe we could have a day clinic or a satellite operation, etc. But we have to wait and see. We have to go slowly, etc.
Are you still recruiting doctors at this time?
We have 2 now. We have 2 NPs, nurse practitioners. They work as a team. We also have a diabetes educator, an RN. We have a dietitian, and we have some counseling services. So we have a lot that we can handle right now. And I know that when we move into the new building, we're probably going to another recruitment component. But if you can imagine, all the people coming in have to be assessed, care plans developed, etc. So the docs and the nurse practitioners can only take on so many in a day, and then they have to follow their patients that they saw a few weeks ago. So slowly we're bringing them all on board, and our plans are just to keep moving along.
And they really work as a team.
It's a very multidisciplinary team. Yes.
Talk about the team. Let's talk about how that works. I mean, a patient. We're going to go in. The person will come in as an intake patient, I guess.
That's right.
And they'll see.
They will come in. They'll fill in an application form. We register them with us. And then we look to see what their needs are, and it'd be more appropriate to be seen by the doctor or more appropriate to be seen by the nurse practitioner. And then if they need other services, we make sure they're available as well. And then they can confer and say, oh, well, I have this problem. Maybe could you help me with that? So that the doc could talk to the NP, because they support each other, and they move forward. So we provide a holistic approach to care with staff who are like a dietitian there as well if there's issues around diabetes, which is a major chronic health problem. They're available to provide that service. We have an RN who's a diabetes educator. We have a counselor as well, because we find there's a lot of people with mental health problems. So really trying to fill in all of the kind of issues so that we could provide good holistic care to everybody.
So it's preventative medicine as well as maintenance of existing regimes.
Prevention is a key word. I think we have to look at that down the way and look at activities. As well, we have a health promoter and a team that will be eventually growing their work in the community as well, because we have to look at prevention. We have to look at promotion. or otherwise it'll just be cyclical and we'll never make any inroads.
Well, obviously, an organization that this needs community partners. Let's talk about some of the community partners involved with the Port Hope Community Health Care Center.
One that we're quite excited about, and it's we're quite pleased with, is that the Northumberland Child Development Center, which is located in Port Hope. They do a lot of work with youth and children in the area, and they were finding that, and they had partnership with the school board, and they provide some alternative support for kids who want to get to grade 12. And they may have health problems. So what we've partnered with them so that Friday morning, Jane Spencer, who is one of our nurse practitioners, she now goes down and is located right in the Child Development Center. She has an exam room, so she now can provide services and support. And it takes time to win the trust of teens, right, and their issues. So that's been moving along, and it's growing and developing as they get to understand that. Rather than them, I know youth won't come up necessarily to our health center, so we want to take the programs to them. So that's a very good example of a partnership. We're working a lot with the health unit and kinds of activities that they're doing that we could help them as well. And we're exploring and developing, and we're limited somewhat because we have a small building. When we move into the new building, we'll be able to hire a few more staff to really go out into the community, see how we can partner and help and support current programs, look at gaps in service, develop new programs, and do the whole 9 yards.
So it really is part of what, because the province is really pushing towards prevention, physical activity, physical fitness, and engaging youth as well. And because a lot of healthcare issues really, when it comes to seeing somebody, it really is a matter of trust. Can I trust this person with my personal problems? You know, especially when you're a youth. You know, I mean, teenage years are hard enough without having to go talk to somebody.
That's right. Yes. Yeah.
So there are people on staff that can deal with that issue. You said you had a guidance, well, not a guidance counselor, a counselor who can deal with issues.
That's right. And we're going to be looking at providing some more support for mental health services as well, because that's another major ongoing chronic disease problem. Diabetes is another thing, heart. So we want to look at prevention programs as well as some direct service with that.
So now the patients that are signing up right now, I guess you're getting long-term care patients, like people are signing on as sort of a general practitioner patient, and then
that's a good analogy. Yes.
But you're also getting other patients as well, short-term, if you will.
Yeah. Our target are, first of all, people who do not have a family doctor. That's one of the main reasons for us being set up, because the province does know that people who don't have a family doctor are using other alternative forms to get care. So they'll go to a walk-in clinic or an emergency department. And I'm not saying necessarily that's wrong, but to provide ongoing continual support and care and support, it's great to have a doctor or a nurse practitioner or somebody who knows your case. So that's our first target group. And then within that, we have target groups that we're really trying to provide support to that have trouble accessing health care. So people on low income, youth at risk, seniors, those with mental health and addiction problems, sometimes may not necessarily feel comfortable with traditional ways. So that's how we're trying to set it up.
Well, and it really does make a difference when your physician has access to your medical history as well, isn't it? I mean,
yes.
Now, how does a physician get access? I mean, if you've gone to the walk-in clinic for the last 5 years, or you're lucky enough to have a friend's doctor squeak you in. I mean, how does all that information get?
Well, what we're finding, what the NPs and docs, because they're both taking on new patients, they have to do they do a medical history and they do an assessment, and then if there are medical records available, and if people sign releases, if they're there, we can bring them on. But we also then have, I want to point out, we have a totally electronic health record, so we scan everything in there so that everything can be there on the computer, so you can go back and see the history, etc. So they'll do the assessment, and then they'll see, people are authorizing their charts to come to us, and then we will take what information is needed from that, scan it in, so we have a complete electronic health record.